Hello, good afternoon, everyone. I can't hear myself, so are you happy that this is working? Fabulous. Lovely to meet you all. My name is Catherine. I'm an aesthetic doctor based in Winchester. I am essentially a clinic owner and former director of the British College of Aesthetic Medicine. And now I'm speaking today on behalf of LPG endermology. I'm going to talk to you about the technology, the history of LPG, what it does, and then talk to you about how the treatment is relevant to the original title. I was given this title, which is quite sexy, but essentially we are seeing a growing population of patients who are noticing or experiencing excess skin laxity following GLP-1 agonist treatment. We know that GLP-1 agonists are incredibly effective in what they do. So effective, in fact, that patients see significant loss of subcutaneous fat. And when now there's emerging evidence that there is also a loss of adipocyte stem cells, which can impact the collagen stimulation within the skin. So not only are they getting loss of the scaffolding structure that they rely on, they're also seeing an increase in skin laxity. And that combination is incredibly difficult for patients to manage, especially when the weight loss happens quite rapidly. So what I'll do is talk a little bit about the history of LPG and how LPG technology can be used in this cohort of patients, not exclusively, but as a case study for what we can achieve in their treatment. So as I've said about myself, whilst I'm talking, we have a video loading that demonstrates the treatment of LPG, because the impressive thing about LPG is that it's completely non-invasive. It's essentially a deep tissue massage. The machine is incredibly tailored so that the technician, whether that be yourselves, your therapist, can be guided through these set processes and set treatment templates relatively easy. And that ensures that you have consistency in your treatment algorithms and with your patients. So LPG endermologie, LPG stands for Louis Paul Gaultier, and who's a French engineer who in 1986 was having physiotherapy following a significant car crash that left him with quite a lot of scars. He required massage therapy, and being an engineer, looked at the physiotherapist and thought, I could design a machine that does this better. So the LPG handpiece is an FDA-cleared, patented technology that uses negative pressure as suction and then positive pressure to create a consistent roller massaging technique that allows consistent results. We're able to massage and deliver massage through the connective tissue, right through skin, subcutaneous, right down to the level of the muscle, and therefore we're achieving consistent results. So when this machine was first designed and came into fruition 40 years ago, it has since seen a significant evolution. But one of the things that it was specifically designed for was scar management. So we have a lot of evidence base, over 175 studies looking at this machine in treating various different medical concerns. It's used very widely on the continent to treat orthopedics, trauma, burns, scars. And it's also used to treat post-surgery, scar healing, wound healing, lymphedema. It has huge clinical implications. We've recently then extended that use into the aesthetics sector, because we know from the histological studies that we have that it is very effective in increasing collagen in the skin. So how does it do that? Well, the process of mechanical massage stimulates vascular blood flow. It increases oxygenation at the surface of the skin, so you're getting more oxygen delivered to the connective tissues all through the layers. It improves lymphatic drainage, so it's clearly used in clinical practice to treat lymphedema. There is a very good evidence of that manual massage improving lymphatic flow through the limbs. Also has impact on the adipocytes. It initially causes a subacute trauma to the fat cells, which stimulates adipocyte stem cells to release things like fibroblast, which go on to produce elastin, collagen, and therefore improve the modeling in the skin. So this machine is clinically indicated to treat cellulite. It's clinically indicated to treat fat, how else can I describe this? The lumps and bumps that we all get along our legs from poor fat distribution. And it has been clinically proven and FDA cleared to improve skin firmness, tightening, and lifting. The amazing thing about this is that it's minimally invasive. It is a treatment that can last between 30 minutes and an hour and a half. The different protocols are preset onto the machine. And we're now collecting evidence on the wellness angle, which is a new angle for us. So we, in 2022, released a study where they had 63 patients, so relatively small, but very thoroughly researched cohort. They split them into a treatment arm and a non-treatment arm. Well, it was machine, LPG, machine, manual machine massage, and then hand massage. And they measured various endpoints. One of the things they did was collect salivary cortisol. They were able to demonstrate that LPG reduces the concentration of cortisol in the saliva from as early as 40 minutes post-treatment, and overall cortisol levels continued to improve over the full course of treatment, which lasted approximately 8 weeks. They went on to collect other things, measure other things such as sleep. They did that by using the biometric markers. We've all got auras and Whoop bands, and they were able to demonstrate improved sleep in the cohort of patients that had had endermologie. They asked them to complete questionnaires looking at their hospital anxiety depression score, pre and post treatment, and they were able also to demonstrate improvement in mood. So we are able to start investigating and discussing the wellness and holistic nature of this treatment. But back to GLP-1. So GLP-1 weight loss or skin laxity really has two significant mechanisms. The first mechanism is the subcutaneous loss of fat. We know that GLP-1 is incredibly effective at mobilizing fat and improving and reducing fat concentration. So patients lose the scaffolding over their skin, that their skin is draped over, should I say. We also now know that the adipocyte stem cells, because of the rapid loss of fat that people can experience, they see a downregulation in the stem cells, and it's the stem cells that are responsible for production of fibroblast, collagen, elastin. So unfortunately, they have a double whammy in skin laxity. LPG can be used to target and improve the collagen side of things by stimulating collagen production through the pathways that I've discussed. But actually, if you think about it, the wellness aspect of it can also help on their weight loss journey. When you sleep better and you have better cortisol, your weight loss journey can be improved. It also helps holistically with other things that can impact weight loss, your hormone balance. So I don't want to extrapolate too far, but there's an exciting area here of LPG's impact on this demographic of patients. But more wider still, in terms of treatment results, we do know that LPG improves cellulite. So patients often, this is a treatment that transcends age groups, because cellulite unfortunately can start very early and go on through the age group. So this is a treatment that, again, patients find can be quite effective. And there's evidence around it improving, LPG improving the circumference of thighs, hips. So we know that it mobilizes the fat cells in a way that helps to restructure them to help tighten and firm the skin and the subcutaneous layers. As you can see, post-treatment, so treatment, depending on the protocol, lasts approximately 30 minutes to an hour and a half. If somebody's having what we call our vitality setting, where they're doing a full body treatment, which really is geared towards sleep and wellness, that's the longer setting. But your therapists post-treatment can then embark in different treatments, such as physical. We have some creams and things that they can massage into the skin, and that the patients themselves can take home to help further achieve some of that stimulation of collagen that we're experiencing with a handheld machine. Typically, patients will come, like I said, twice a week, and initial courses last between 10 and 12 weeks. And then there is a maintenance that can occur. So patients can continue to come and see you for maintenance treatment. What my patients tend to report are threefold. first of all, whatever we're treating, whether it's cellulite or fat mobilization, they get a positive response from that. But patients report that it helps their legs feel lighter. So you're getting this kind of unintended but beneficial lymphatic drainage, which everybody benefits from if you feel a little bit lighter. Patients also then tend to report that it helps with their sleep and general stress levels. So again, these are anecdotal in terms of we have evidence base for it, but that's not necessarily what we're treating, but those are the positive outcomes that we get from the treatment. Endermologie is very widely used on the continent and in Europe, but it's relatively new to the UK. So it's something that we are taking the opportunity to educate people about. But it is an area that isn't new. It has a very long history and a strong evidence base across Europe with over 175 papers that we have. I've taken the liberty of just using a couple of photographs of patients. They're not the best photographs. Ideally, I would like to have a background and use measurement markers. But this is a patient who had lost weight using GLP-1, and she was concerned about the laxity in her upper arm. If you look at this picture here, if you look at, hopefully you can see there's a little bit more sort of, I don't want to use the word sagging, but tissue in the before photo, and in the after photo, it's a little bit better toned. In an ideal world, you want to be more precise with your photographs, you want to measure the change, but if I draw your attention to the area around her elbow, you can see there's slightly less crepiness there. These are the kind of results that we're hoping to achieve. We are realistic in what we can promise our patients. We're not trying to say that this is comparable to surgery, but as an adjunct to eating well, exercising well, lifting weights, doing all the things you should be doing, endermologie has a strong place for improving skin laxity. Again, she's got arms up in one picture and arms down in another, so it's not ideal, but if you have a look at the before and the after, and especially around the bottom, this is a patient who, again, has had a little bit of, has had some GLP-1 treatment and is looking to improve the buttock area, and has had a course of, I can't remember, course of 14 over 12 weeks. And finally, this lady, it was her abdomen that was of concern. A couple of things to take away. There's no age limit, so it is accessible to a wide demographic of patients. It's safe. There is no reported adverse outcomes. It is relatively quick to deliver and has the potential of having positive systemic wellness effects as well as improving the skin tightening. So all in all, a relatively effective treatment that can be used in combination with other treatments that you may have. But again, the demographic of patients benefit from the treatment that we offer, and they're not looking for drastic results. I'm very clear with the patients. These aren't patients who don't necessarily, maybe they don't want surgery, maybe they're not suitable for surgery, or the other group of patients are not quite ready for surgery and prepping their skin in order to go on to surgery. So it works quite nicely for that. And then finally, I think that's pretty much it. Are there any questions? That's a whistle-stop tour of LPG endermologie. The endermologie stand is just in the corner over there, and there's a full team. So if anyone has any other questions, we also have an endermologie search engine, a clinic finder on their website, as well as all of the studies that have been done on endermologie thus far. So if you just Google LPG endermologie, you should be able to find more information there. Thank you all. Thank you.